So the first question I almost got into a moment ago is just about the new liver allocation policy, the solid organ allocation policy, something that Senator Moran and I have been very interested in. We had one meeting with the Organ Transplant Procurement Network group, and frankly, our view of that meeting was very different than what they finally did. Both the University of Kansas and Washington University are really among the leading stakeholders in this in terms of the transplants that they're part of. I guess the problem is that states in the Midwest, states in the South, states that have lots of small communities tend to be much greater organ donors. And obviously, as long as we had a regional view of this, that was a benefit to their neighbors. Been a dramatic decrease in availability of lung and liver transplants at Barnes Hospital, at least, since the new policy went into effect. And that's my question. I think there'll certainly be a lawsuit filed here. Will you commit today that you'll ask OPTN, the transplant group, not to move forward with this controversial policy until that lawsuit has been dealt with?
Well, Mr. Chairman, I am concerned about the liver allocation policy issues you raised. There, frankly, any transplant organ allocation policy issues are quite difficult politically and as a matter of public health. And I received a letter from you and many others about the most recent the liver transplantation allocation policies out of OPTN. And we requested of them to think again and to ensure, especially I believe it was it the Kansas and Missouri providers, that we wanted to ensure especially that comments that came in at the last minute or perhaps came in late were fully considered by OPTN. We recently received a letter back in response to my challenge to them, which I believe your staff has access to, where basically they said they went through the procedures, they considered all of the comments, and they remain steadfast in their conclusion regarding the science and technical aspects of the allocation decision they made. I do believe my cards are played out here. Congress deliberately set up the OPTN system to keep people like me from actually dictating the policy allocations, but I'm happy to work with the committee on any other solutions here to look at ensure that the fair and scientifically valid treatment has been given here.
Well, I would think that one of the reasons the old system worked was that people were more encouraged to be donors if they believed that people in their community would benefit from that. On liver transplants, under the new policy, we think there'd be 32% fewer transplants in Missouri. I think Barnes Hospital's number 4 or 5 in the country in transplants, and they have told me since this started, they're now having to send teams of doctors across the country to get organs that would have been available under the old policy locally. I think it's further complicated and added expense and precious time to the system. We're going to continue to watch that.